Supermarket workers in southwest Sydney and hotspot LGAs will soon have priority access to the Pfizer vaccine. New South Wales Chief Health Officer says it is crucial to vaccinate these essential workers that are required to keep the city running and functioning. The Shoppies Distributive and Allied Employees Association of New South Wales Branch Secretary Bernie Smith joins me live now. Bernie, thanks so much for your time. This is a really good move. Do you know how it will be rolled out and how long it is going to take?
Well, look, we're really pleased. This is something that's been months in the making with constant discussions with government about the need for this, because the reality is warehouse workers and supermarket workers don't get to stay home no matter how tight the lockdown gets if we want food on our table. So in terms of the rollout for supermarket workers in these 5 LGAs, from tomorrow there'll be 500 appointments a day opened up at the Homebush vaccination hub, and so there'll be special measures put in place for those people to make their bookings. That's all been ironed out today. And then for the warehouse workers, we'll have warehouse workers turning up at DCs across Sydney early next week, we hope, with on-site vaccination hubs set up for them specifically at their workplaces.
Okay, we're 6 months into this vaccine rollout. I mean, should it have been done earlier?
Oh, yes, we've been talking since December last year about this when we had the Northern Beaches cluster. We wrote to the Health Minister, both in New South Wales and federally at that time, Mr Hunt, as well. We followed that up a number of times this year with the Health Minister in New South Wales. Supply has always been an issue constantly. I think there's been a willingness here in New South Wales to do something, but they've been frustrated by the way the rollout has happened. So we are pleased that this happened in those 5 LGAs, but to be honest, it's not just those 5 LGAs. We need it across Greater Sydney. We need it across New South Wales and across the country. We saw the Belrose supermarket close down in the last couple of days because of infected workers and infected members of the community.
Yeah. How many of those frontline workers do you suspect are still unvaccinated right across the state?
Sure, but we've got a very young workforce when you think about it, and when you realise that there's been limited access to people under 40 to vaccines until just recently, there's a very high proportion of people who wouldn't be vaccinated yet. Add that to the hesitancy some people have had, unfortunately, about Astra, which has been another unfortunate part of this rollout, and I think that this is a great step forward for these people to get Pfizer access and get vaccinated quickly, and we need more of this as the supply improves.
Yep, sure, when the supply improves. When do you think that might be?
Oh, look, I know there's a real frustration here in New South Wales, and even when the Pfizer jabs land, they need to be tested appropriately before they're released. So I would hope it's coming very soon, but we've been hoping that for a long period of time. So this is a good initial step, but I think more needs to be done, and it needs to be done really, really quickly here in Sydney.
Yeah, look, what is happening to get these people vaccinated more quickly? Will they be sent to special hubs? Will they be given early appointments at GP clinics in their area? What are you doing to make it easy?
So at the moment, with the 5 LGA supermarket workers, that will be opened up through the Homebush hub. So that's where they'll be making their appointments. But I think as we go through the next few days, there'll be more clarity as to how that might spread, if it is at all possible. But at the moment, we understand there's 500 appointments a day being opened up from tomorrow at the Homebush hub, and there'll be a special way for people to make those applications to who are supermarket workers.
Should it be mandatory?
Oh, look, we've never said that this should be mandatory, but we strongly encourage everybody to take up the vaccination, as that's our way out of the restrictions we currently face. We've got thousands of members currently not able to work and who are getting by on far less than they would normally receive. And those workers, we would hope too, are very supportive of the need for this vaccination. And I think that we can achieve high levels if we've got appropriate supplies. So whilst we don't say it's mandatory, we strongly encourage it.
Do you think, 90%, 80%?
Oh, look, I think that's probably a question for the chief health officers around the country.
Yeah, fair enough. Just finally, should there be incentives for these frontline workers?
Oh, look, I think that'd be a great idea. We've had the sort of voucher program here in New South Wales for all people over 18. But why couldn't we extend that out to some extra benefits for people who choose to be vaccinated?
Yeah.
It is a choice, but if you can give an incentive for people to do that, I think that would be a great step forward and a very low cost, really, compared to the benefit for the community.
Are employers allowing their staff the hours to go and get these vaccines? Do they have to do it on their own time, or are employers covering that?
Realising how important vaccination is, and as do most employers in our industry, we've been working hard with them Most big retailers have now got vaccination leave in place. So Woolworths, Bunnings, Coles, Officeworks, Target, Kmart, even Aldi yesterday finally agreed as well. So there's paid leave in place. It was just access that was the real problem for our members.